All right, next drug we have is, if you can read it, potassium chloride, which is an electrolyte supplement. So the method of action for this one is it's going to increase your potassium levels in your body. It's going to support normal cell function, and additionally nerve signaling and muscle contracting. So you're going to use potassium chloride to prevent and treat hypokalemia, so when your body doesn't have enough potassium, for other metabolic disorders, and as a potassium replacement. We administer this med as an oral tablet or an IV, and we want to make sure that's diluted, but a lot of the tablets are also able to be dissolved in water if need be. Some of the precautions we have down here are renal impairment, dehydration, Addison's disease, and diabetic acidosis, as well as over here we have some interactions, which would be potassium-sparing diuretics, ACE inhibitors, ARBs, and heparin and digoxin. All right, talking more about potassium chloride, we're going to talk about the complications. So you can have hyperkalemia. You know what? You can have hyperkalemia, which can lead to heart arrhythmias and muscle weakness. You can have tissue necrosis, GI irritation, which is going to be your nausea, vomiting, diarrhea, all that stuff. Phlebitis, inflammation of the vein, and electrolyte imbalances. As a nurse, we're going to monitor potassium levels. We're never going to IV push or bolus potassium. That can lead to a lot of really bad cardiac effects. So you can put it in IV diluted, is what we talked about earlier, but never put it in IV push or bolus. And we're always going to ensure hydration in our patients. The patient itself, for education, take with food and water, stay hydrated, and avoid salt substitutes that contain potassium. And last but not least, is this med working? If this med is working, you're going to see normal potassium levels, and we're going to see a lot less symptoms of hypokalemia, so that weakness, fatigue, and muscle cramps, those are all going to decrease as your potassium levels come back up to normal.